Privacy, credentialer's responsibilities. Even if you've only been with the VA for a short time, you may have already recognized that we emphasize privacy and confidentiality. Privacy and confidentiality is the required training before you're granted access to VetPro. So if you don't remember completing the training from our website, then you'll want to make sure you complete this training so that you are in compliance with the credentialing and VetPro security policies. We have national calls and presentations in February or March and September or October of each year. And while each presentation may complement the other, there are two separate and distinct presentations. February or March presentation is presented by the Privacy Officer in the VHA Privacy Office, and the topic is the Privacy Act and Confidentiality. September-October call is presented by our office, for Security and Confidentiality. It is the credentialer's responsibility to understand the Privacy Act, and we are expected to be subject matter experts, so your Privacy Officer and FOIA Officer, or Freedom of Information Act Officer, should be your very best friends. Keep them on speed dial. Today we'll cover definitions of Privacy Act and confidentiality, and we'll cover the implementation of the Privacy Act. The Privacy Act was created in 1974, and for the history buff, it took effect in September of 1975. The Privacy Act applies to any VA record about an individual that is retrieved by the individual's name or by any other identifier, such as the Social Security number, an abbreviated name, date of birth, or a signed ID number. The individual has the right to see their VA records. However, this request must be in writing to access and review their VA records. In addition, the individual also has the right to have the VA record amended when they are not accurate, timely, meaning there might be a service chief comment that describe events that had happened 3 years ago instead of relevant information. On an initial appointment, this might be relevant, but if the service chief completes another review, then discussion of events 3 years ago may not be appropriate. If the VA record is not complete, they would have the right to amend these records. Or if it's not relevant, for instance, if you have a dietitian going to an RN position, is the information relevant to the RN position? Or maybe a nurse working in an acute care had an issue with medication management. Would this information be relevant if the nurse was converting to a physical therapist or an occupational therapist? Questions about release of information needs to be directed to your privacy or FOIA officer. Although privacy and FOIA are closely related, they are very different. Privacy is concerned with the protection of information, and FOIA is concerned with affording the most disclosure of information under the law. FOIA, the Privacy Act, never prohibits a disclosure that FOIA actually requires. So if there's no Privacy Act authority to withhold the information, it must be disclosed. Privacy Act prohibits disclosure of any records about an individual, unless it is authorized by that individual, or unless it is specifically authorized by policy to be released without the individual's written authorization. First, we'll take a look at authorized disclosures. The authorization must be in writing and received from the individual whose record it is. It must be addressed to the VA. It must describe the records to be released and to whom the records are to be released, and for what purpose the records are to be released. If you make copies, you must account for the disclosure, and this information must be provided to the privacy officer in an acceptable format. The process and format is determined at the local level, but it must be done. Now let's take a look at what can be released without the individual's written authorization. Without written consent, it has to be a need to know. Who makes the determination of a need to know? You. Because you are the system owner of the credentialing records for your facility. So you are responsible to ensure that each person who has access to the information has a need to know, the information in their official capacity. If you are not certain, ask your privacy officer. Freedom of Information Act. Check with your FOIA officer. Routine uses. These are published in the System of Records Notice, or SORN, S-O-R-N, or you may also see the acronym SOR, S-O-R, which also means System of Records. And we'll talk more about these routine uses. Law enforcement entity requests. Medical emergency. Requests from Congress. Court orders. Remember, most of these are stated as VA may disclose, so your privacy and/or FOIA officer are managing these requests. 99% of the questions to our office regarding release of information are directed back to your local privacy or FOIA officer. Previously noted System of Records, SOR, S-O-R or S-O-R-N. These are records in an agency where the records are retrieved by a name of an individual or other identifying information, such as a Social Security number, date of birth, assigned ID number or symbol. All records maintained this way must be maintained in a system of records. VHA has many system of records. Just to name a few: blood donor information, non-VA fee-based records, patient medical records. But our focus today is on healthcare provider credentialing and privileging records, VA 77 VA 10Q. Last version was published in the Federal Register on March 26 of 2008. So under 77 VA 10Q, records in the system consist of information related to credentialing of applicants who are considered for employment or appointment, or who provide healthcare services under contract or other agreement, such as a fee basis or WOC without compensation. And it is information related to the professional's credentials and the reevaluation of the clinical competency. The records under 77 VA 10Q may include, but not limited to, individually identifiable information, address information, biometric data, education and training, licensure, registration, or certification, citizenship, honors, awards, appointment information, mental and physical status, evaluation of clinical and/or technical skills. Currently, there are 23 standard routine uses, and these uses are not statements describing routine use of data internally by VA. They are statements of how the VA may legally disclose the individual information to an outside entity without their permission. Routine uses only give you authority under the Privacy Act. You may still need authority under HIPAA, H-I-P-P-A, and Title 38 U.S.C. for protected diagnosis, drug abuse, alcoholism, and alcohol abuse, infection with human immunodeficiency virus, and sickle cell anemia, name and address, and quality assurance documents. You need to be familiar with the system of records as you are considered the subject matter experts. Know your privacy and FOIA officer. They are there to help you. The system of records on several VHA websites, on the OQSV website, as well as the privacy officer website. Continuing on with the standard routine uses, let's look at routine use number 6. Can you provide copies of records to the Joint Commission surveyors? No. They can view the VetPro record, but they don't get copies. You drive and operate the VetPro software during a Joint Commission audit. Routine use number 8 most likely is a response to a tort claim. And routine use number 9 most likely used with agreements such as contract, sharing, affiliations, and partnerships. We can't emphasize enough, get to know your privacy and FOIA officers. Because routine use number 19 says, VA can disclose the following to prospective federal or non-federal health care entity, including relevant information concerning the individual's professional employment history, including clinical privileges held, final decision that results in voluntary or involuntary limitation, reduction, or loss of clinical privileges, payment that is made in settlement of or in satisfaction of a judgment in a medical malpractice action or claim when VA process was followed. Routine use number 10 may be the most important routine use. This may allow disclosure of information concerning healthcare practitioners' professional qualifications and clinical privileges that may be disclosed to the VA patient or representative, and the disclosure is limited to information concerning the professional's education, training, licensure, certification, employment, and current privileges. Record Control System RCS 10-1, 10Q1, defines the retention requirements for healthcare provider credentialing and privileging records. It recognizes the electronic file with the March 2011 amendment. Documents maintained electronically are not to be maintained on paper. You verify the document was scanned into Repro and accurately quality controlled, and then destroy the document by witness of disposal, defined as documented destruction witnessed whether by a federal employee or by a contractor, if authorized. Then you maintain only a two-part healthcare provider credentialing and privileging record on all providers appointed on or after March 1st of 2011. Part 1 of the folder contains the local documentation for the facility. Part 2 of the folder is the clinical privileges or scope of practice for the provider. Retirement of healthcare provider credentialing and privileging records. If the provider left the facility prior to March 1st of 2011, the record is retained at the facility for 3 years and then retired to VA Record Center in accordance with the records management policy. If the provider was appropriately appointed at the facility on or after March 1st of 2011, only a two-part folder should be located at the facility, which contains locally required documents and clinical and privileges or scope of practice. The deadline to accomplish this was June 30th of 2012. All documents maintained in Repro are destroyed by witness destruction. Provider profile, FPPE, OPPE, and clinical practice file maintained at service level is protected by and therefore managed the same way as the healthcare provider credentialing and privileging record. Provider leaves the facility subsequent to March 1st of 2011. The two-part folder combined with the provider profile is retained at the facility for 3 years, and then the files are retired to the VA Record Center in accordance with records management policy. 38 U.S.C. in a nutshell provides that records and documents created by VHA as part of a designated medical quality assurance program are confidential and privileged and may not be disclosed to any person or entity except when specifically authorized by the statute. The key requirement for records to be protected under this statute requires a formal written designation by the Secretary or designated authority that the activity is being conducted for the purpose of improving quality of medical care or improving the utilization of healthcare resources in VHA healthcare facilities. Please email questions regarding this training through Outlook to vha-priv@va.gov. We'll be glad to respond to all questions. Thank you.